All right, now we're on to some health news. It is considered the most important organ in your body, which is why you want to keep your ticker in tip-top shape. I recently spoke with board-certified cardiologist and medical contributor, Dr. Stephen Sinatra, about 5 facts that you should take to heart. Doctor, thank you so much for being with us. I want to talk about a recent study that I was thrilled about, and that is that a few cups of coffee daily can cut your risk of heart disease. Is this true?
Yeah, actually it is. I mean, I've been privy to this research for decades, and there's always been research for caffeine, against caffeine. Remember, 100 years ago in Europe, caffeine was a treatment for asthma because it opens up the airways. Now, caffeine is a potent antioxidant. It does a lot of good things. But remember this, there can be caffeineism as well. I've seen it as a heart specialist. So 1 or 2, possibly 2.5 cups of coffee is fine. But if you get into 3, 4, 5, or 6 cups of coffee a day and have abundant caffeine in the body, and if the liver can't detoxify it because of all the toxins in the environment, these people run into trouble.
All right. Thank you for telling me that. I'll try to eliminate my afternoon cup. Okay, second point. Now, this I'm really interested in because I'm sure, as you can hear, I have interesting vocal quality with a little raspiness. Is there a link between a person's vocal quality and the health of their heart?
Oh, definitely. People suffering from congestive heart failure, for example, they have weakness, that their chi energy is down, and consequently their voice content is down. It's faint, they're hard to hear sometimes. People who speak fast, rapid, out loud, or people who interrupt your conversations, we call this a type A behavior pattern. And this is incriminated in heart disease as well. There was a recent study only a few months ago in the American Journal of Cardiology that pointed this out. So a softer voice is always better.
Sure. All right, now let's turn to intense exercise. Can that increase the risk of a heart attack?
Oh, as a cardiologist, I saw this over and over again. I remember one of the cases, there was a 36-year-old Marine who was playing racquetball against a younger participant at 19 years old, and he died on a racquetball court.
Oh, no.
He had a massive heart attack. Fortunately, we resuscitated him, and, we got him back to life. But the literature is full of this. First of all, racquetball is start, stop, start, stop.
Exactly.
It's really not a good sport for the heart. Also, marathon running. I mean, I got to be honest with you. Marathon running, I mean, it's been reported over and over again where people die during marathons. So these are 2 sports where, as a cardiologist, I would tend to tell people to do less of because, again, they're incriminated in heart disease.
Right. Good news for me. I don't do either. So that's promising for me. All right. Next up, let's talk about COVID-19 and how it affects the heart. We're now hearing things now that we've been dealing with COVID for over 2 years. What are you seeing are some of the ramifications of it?
There's a receptor in the body. We call it the ACE receptor. And the COVID-19 virus locks into this receptor. It's like putting a key in a lock, so to speak. This sets the stage for endothelial, what we call dysfunction or inflammation. When you get inflammation of the heart, we call this myocarditis. This is frightful. I can tell you, as a heart specialist for decades, when I saw this in young people, I was very concerned because the remedy for myocarditis is rest. Rest, 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 because when you exercise, you can trigger more inflammation in the heart. And when you do this, the heart's vulnerable to arrhythmias. It can go out of rhythm. That's why, if you're an athlete, whether in high school, college, or a pro athlete, and you get COVID-19, you need to rest because there's been lots of cases of sudden death and arising from cardiac situations in these athletes because of dreadful malignant arrhythmias. So when it comes to COVID-19, we've got to be very cautious in the athlete.
Absolutely. Last question quickly. Is it true that women suffer heart problems at a higher rate than men?
Oh, gosh, absolutely. I mean, women get heart disease more than men. There's a lot of theories out there.
Yeah.
But remember this, women are more vulnerable to heart disease than men. Why? Because the size of their heart is smaller. And, the size of your heart is about your fist. And women have smaller blood vessels. That's why with angioplasty or stents or bypass surgery, they have more complications because the blood vessels are smaller. Anatomically, they're behind the 8 ball, so to speak.
Right.
So it's important for women to practice good risk factor modification. And when you're in the workplace, use your intuition.
Yes.
Use your right brain. These are the greatest assets in protecting women from heart disease.
Oh, doctor, such great information. We so appreciate your time. Thank you.
Thank you, Christine. This was a lot of fun.
Wow, he was fabulous and such useful information. So when it comes to that cup of joe or those intense workouts, just remember everything in moderation. And before you try anything new, check in with your physician to make sure it's right for you and your heart. Well, thank you for it.